There we go. I'll do a brief community and accessibility guidelines, and also please message myself, Sam, or Lindsay, or if you have any accessibility needs that are not currently being met in the chat. Yeah, accessibility community guidelines. Please keep language and interactions with one another respectful. Remain muted while others are speaking. Write stack in the chat or raise your Zoom hand to convey that you'd like to speak. Stack will probably be the best way, just like this. And we'll put people on, the list of who's like, it's like you're lining up to the, microphone to speak. Step up, step back. Just a general rule of thumb, if you don't share a lot in calls, like definitely encourage yourself to ask questions, to come and engage. If you've already talked a few times, maybe just like sit it out for a moment to let someone who is maybe needs to engage more. And then also Zoom captioning and auto translation would be available. Now to the more fun part. To introduce Nora, first of all. Nora is a writer, public health expert, and associate professor of nursing and health studies at the University of Washington, Bothell, whose work examines how politics, technology, and inequality affect health. I thought this was great introduction from her faculty page. Her research explores the politics of global health governance, the socio-political impacts of HIV initiatives in Southern Africa, and the changing roles of philanthrocapitalism and corporations in shaping global health programming. We will be hearing about and discussing together Nora's latest book, Crowded Out, The True Costs of Crowdfunding Healthcare, released just last month. The book explores one of what I think a lot of us consider twisted realities of healthcare in the US, crowdfunding. Crowdfunding, if you don't know or are sort of familiar, is making a public appeal for fundraising for a personal project, a campaign, an invention maybe, or in the dark reality that we live in, healthcare, basic health needs. Many of you are likely familiar with the biggest and most popular platform for this, GoFundMe. Backed by research and data, Nora's book takes a closer look at the phenomenon of healthcare crowdfunding, the ways in which it reproduces many structural race and class inequalities in our society, the moral bankruptcy of having to perform suffering and the profit leached off of that suffering, and the toxic effect it has on public health writ large. The book is a fascinating and infuriating read, and I say that as a firm approval of it, and really implore you to check it out. Sam's going to drop the link in the chat there. I also just want to say, like, in the critiques of these practices in Nora's book and what we're talking about tonight, I want to make clear this is not a judgment on anybody using the platform, anyone who's ever used the platform. I'm confident everyone here either knows someone or has themselves used a GoFundMe or a similar platform to raise money for healthcare or other basic necessities. This is an indictment of the system that we live in that commodifies things that should be public goods, like housing, like education, and notably healthcare. And with that, I will pass it over to Lindsay Muniak, my fellow organizer at the Debt Collective, who I work with on medical debt and healthcare issues.
Thanks so much, Margaret. And yeah, I want to start by underscoring how exciting it is to be talking about this with Nora and drawing these connections between medical debt, which, as I think most people here are aware, doesn't exist in a vacuum. It's a symptom of the way that our healthcare system is structured, and the various institutions and projects that pop up to take advantage of the insecurity that system produces, like GoFundMe and other crowdfunding platforms. And so I was really excited when Nora first reached out about this book being released, asking if we wanted to do something in relation to it, and glad that someone has, as Nora has been doing for the last few years, spent time turning a really critical eye to what has become a massive phenomenon that I think we've all just started to take at face value, that of crowdfunding for healthcare. And this is also the first time that Nora and I have had a chance to talk about her work in a formal setting like this. And so I'm excited to be able to ask some detailed questions and sort of hear and digest the answers with everyone here. And so I want to start, Nora, by asking you, your previous academic work includes a book on the political consequences of the fight against AIDS in Lesotho, as well as edited volumes on global health governance, the political dimensions of HIV programming. There's a really wide range of international study that like you've spent time with. And as Margaret, of course, noted during the introduction to your newest book, Crowded Out just now, the one we're here to discuss, this book turns a critical ethnographic eye to the growing popularity of the crowdfunding model as a stand-in for healthcare system, particularly in the US, that wouldn't, as ours does, trap its patients in fear and debt. And so sort of two questions for you. The first is, what is crowdfunding? Because we've been using this as a sort of obvious term, and it might not be, or at least it's worth unpacking. And the second is, what sparked your interest in this, and how does it relate to or mark a shift away from your previous research? I know, as many here do, I'm sure, like that the consequences of the way that our political and economic systems are structured internationally are never divorced from what we see within the US. So would love to hear your thoughts about that.
Thank you so much for having me, and thank you, especially Lindsay and Margaret, for organizing this. I'm such a huge fan of the Debt Collective and all the work you do. And for me, in thinking about this book, it really feels like the flip side of the work that Debt Collective is trying to do in terms of building better health systems, kind of from the top down and from the bottom up. So I really appreciate this question about like, what is crowdfunding? Because crowdfunding can be many different things. It can be, you know, Kickstarter for various kinds of projects or initiatives. It can be, you know, coin jars on the grocery store counters asking for help with family needs. It can look like community organizing efforts. It can look a lot like a lot of kind of advocacy organizing efforts that we do in our communities. The kind of crowdfunding that I'm really talking about here is crowdfunding for individual needs, and typically using tech platforms. So that can be platforms like GoFundMe. It can also be things like reaching out to people via WhatsApp or Venmo, right? And asking for money that way. But one of the reasons I'm really interested in crowdfunding for individual needs and in this kind of charity space is because that is really what we've seen sort of take over a lot of crowdfunding more generally, not just in the US, but around the world. And the majority or the largest proportion of that crowdfunding is often for medical and healthcare costs. So I actually stumbled across GoFundMe back when it was like this tiny little website that no one had heard of, when I was working on a different book and I was eager for distraction. And at the time, when you set up a GoFundMe campaign, they would actually give you like a printable flyer with like tear off tabs at the bottom that you could actually kind of post around your neighborhood, because the site had so little name recognition. And at first I was just sort of like, I'm an ethnographer, so we like weird phenomena of, you know, society. And so I was like, what's going on here? Like, what's happening? What is this? But very quickly, I found that it was echoing a lot of things that I had actually seen in the global health space. So the global health space is very much dominated by a sort of politics of charity, right? Whether that's charity in the form of large government grants or philanthropic institutions or non-governmental organizations that are doing a lot of charity work. And a lot of times I had been working in contexts where access to very basic forms of care was only possible through the sort of charity organizing of this kind of global health monstrosity. And so a lot of my earlier work had sort of said, okay, well, like, what are the consequences of doing care this way? And in particular, what are the political consequences of that? And one of the things that I've written about a lot in my work is the way that, you know, people who are receiving care through various sort of philanthro-capitalist or charity initiatives have very different sort of scope in terms of what they can politically advocate for than people who are getting care through a social contract or through their rights as, you know, empowered citizens. And so that was kind of the frame that I was bringing to this. And I also wanted to turn a critical eye on the US as a site of global health inequities, right? So the US often touts itself as this, this worldwide change maker that's bringing all these innovations and great ideas to the rest of the world, including, I might note, the US is a promoter of universal healthcare in other places, just not here. And so I wanted to kind of turn an eye to the US, not just as this like powerhouse of global health ideas, but also this sort of creator and amplifier of global health inequities. And so this really became a sort of window into the worlds of how the US healthcare system creates and amplifies and deepens health inequities through its kind of market-based healthcare systems.
Yeah, thanks for drawing that connection. I mean, it really is something where the market logic it's already governing our healthcare system as it functions, right? This is something that we spend so much time working on, kind of trying to unpack the reason that our healthcare system is quite as bad as it is. This is something that I get asked a lot by my in-laws who live in Slovenia. They're like, if everyone hates it so much, why is it so bad? And I'm like, that's what I try to answer every day. and it really, what it comes down to is there are too many financial interests stacked against change that would transform it into something that works for the people it claims to serve. And it's interesting to think about how that market logic really does then go into not only the healthcare institutions, the insurance companies, big pharma, big tech, or biotech, but it also goes into the imperative on patients to meet their medical debt obligations, to pay up. They have to become entrepreneurs, and this is something that you talk about at length in ways that I found really striking. And I want to just very briefly read a couple lines from relatively early in the book when you introduce this idea of moral toxicities. You write that, let's see, is $1,000 of support for 2 years of cancer. This is referring to a patient who had what is comparatively a rather successful crowdfunding campaign. Is this really amazing? And does it distract us from more systematic ways we could care for people and think in terms of what everyone deserves, regardless of how they are perceived by the crowd? As I will argue throughout this book, crowdfunding powerfully lowers the expectations of vulnerable people as to what they deserve, while enabling those in positions of privilege to assume they are more deserving of assistance because their campaigns are often more successful. These dynamics are typically invisible to donors, which includes many of us who I'm sure have donated to GoFundMe campaigns, to broader publics, and even at times to the crowdfunders themselves. They arise from implicit moral values that crowdfunding feeds on and reinforces. In this book, I call these moral toxicities, harmful ideas rooted in widely shared social values about whether and under what conditions people deserve help, healthcare, and society and social protection. And you go on to talk a little bit about what these categories of moral toxicity entail. And I would love for you to expand a little bit on how you break those down and understand those and their relationship to the free market, the hustle culture that that we talk about in relation to other aspects of our lives.
Yeah, this is a great question. I will try to do justice to it. So one of the things that really interested me when I started looking at crowdfunding was the way that it reflected at the very same time this like collective desire to help, right? This sort of bringing communities together and people doing stuff together, all the sort of like warm fuzzy stuff that we can get from crowdfunding opportunities or campaigns. And then also this very individualistic sort of like hustle or you die sort of late capitalist hellscape, basically. And I was really interested in how it could evoke like both of those feelings for us at once and where that was coming from. So in the book, I sort of borrow / adapt from a term that public health and medicine folks have been using for a while, which is to talk about the financial toxicities of healthcare. So a lot of you may have already heard this type of term, but it's the idea that when people face very high out-of-pocket costs for their care or costs that are, insurmountable for them, it actually acts like a toxin in their care. It worsens their health outcomes. It exposes them to greater health threats, and it lowers, oftentimes, especially in the case of cancer, it lowers their chances of survival. So oncologists talk about financial toxicities as these sort of like individual level, sort of like financial toxins that enter into the sort of treatment landscape for patients. I'm kind of interested in them at more of a systematic social level, which is that like all of us face financial toxicities in the healthcare system, and it impacts us in much the same way that like air pollution impacts us, right? It's in the air that we breathe. It accumulates in already vulnerable communities. And so I began to start to think about some of the moral notions that I was encountering in crowdfunding as similar types of toxicities. And it really came out of just being mired in looking at GoFundMe campaigns day in and day out. And what I noticed was that a lot of campaigns made very similar types of appeals. They talked about how someone deserved help because they were a good person, or they talked about feeling a great deal of shame about having to ask friends and family for help. Or they talked about the idea that hardworking Americans really deserved this kind of help. And so I started to try and unpack and give people a bit of a sort of like conceptual language for what was happening here morally, and why it evokes both this like feel goody, yay, rah, rah sort of reaction and from the crowd, and also makes us feel profoundly uncomfortable. And so the book really talks about a series of kind of moral toxicities that kind of are very much amplified by the crowdfunding system. So this idea that of selective deservingness, this idea that only certain people are uniquely deserving of help, that in order to have a successful campaign, you have to be like the most wonderful, extraordinary person with the most tragic story that has ever happened, right? Or the idea of sort of this rampant individualism that we have here in the United States, that, when you get sick, it's basically on you to figure out how to hustle your way out of illness and hustle your way out of medical debt. And so I use those as a kind of set of frames to help people better understand not just the broader system that's creating crowdfunding, but also the way that crowdfunding is normalizing that system for us. Because what we see with campaigns is that they travel. Like all of us see crowdfunding campaigns all the time, all day long, whether it's on the news or our social media feeds or coming directly from our friends. And those campaigns are normalizing these ideas and amplifying them at the same time that they're really undermining some of the ideas that are very central to working towards more universal and more just healthcare systems, right? So every time we see a campaign, we're getting normalized to the idea that like, I get to pick and choose who gets help in this totally messed up US healthcare system, right? And not everyone's gonna get it. And we're gonna have to outcompete each other in order to get basic charity. Those ideals are completely antithetical to and run counter to the kinds of moral ideas that we would want to build a more universal healthcare system on, which is the ideas that everyone deserves help when they are sick, right? That everyone deserves a certain, not only basic level, but actually quite comprehensive level of healthcare, regardless of how many friends they have on Facebook or, how much wealth is embedded in their social network.
Yeah, wow. I mean, it's one of the things that struck me reading the book, and that's striking me again, just like over the head repeatedly as you're talking right now, is this analogy to, in a good way, I saw your like grimace, is this analogy to the type of means testing that the Debt Collective fights at length from various social programs. The few that we managed to get through, there's such a drive to ensure that the worthy poor, the worthy suffering are the ones who are actually receiving the benefits. And one of the points that we really try to drive home to people, and that it's always surprising how unintuitive it seems to be for people who've grown up and within this kind of like American hustle culture, individualizing culture, that the means testing process, by requiring people to jump through hoop and hoop and hoop, ends up reproducing the same inequalities that the social service programs are purporting to intervene against. It ends up excluding the same people that it's in theory supposed to justify support for, the most in need, the people who aren't like just coming through and skimming off the top. And obviously we think these narratives are foolish all around. Our demand is consistently across all of these debt types anytime we're fighting for a type of debt relief, which is always, again, just a sort of step in the fight for public goods like education, like healthcare, that are free at the point of service, guaranteed for all. But anytime we're fighting for debt relief, we have to repeatedly underscore this, like no means testing demand. And repeatedly there are debt relief programs like those for Corinthian college students, where it took years of making this demand again and again and again before the federal government in 2022 finally was like, okay, we're going to wipe all of the federally held student loans owed by the people who went to this predatory chain of for-profit colleges at the source, because this application program that we've set up to ensure that only the worthy are really getting the relief they deserve is so clearly and emphatically a failure. Mm-hmm. And it's also interesting the way that people kind of talk themselves out of their own deservingness, worthiness, their entitlement to a life without debt, without living in fear that a medical emergency is going to devastate your family, financially, as well as whatever emotional turmoil it produces. It's something that we hear from debtors all the time. Like, well, my situation isn't really that bad. I only have $70,000 of medical debt, and I saw someone who has 500,000. So I really have no right to complain. And it's why we try to kind of like, again, cut through that impulse to be like, no, it's all unjust, because we think that healthcare should be a public good, should be free to everyone. And as you point out throughout the course of the book, by sharing some pretty devastating cases, most GoFundMe campaigns, even the ones where people have kind of like hustled to set them up, to make a kind of pitch, to tell their story, often in ways that seem to feel a little like self-exploitative at times. Most of these campaigns do not yield like real substantial financial results for the people who've started them, let alone like produce a type of economic security that we might all fantasize is what will come out of that. We'll help these people get on their feet, and then they'll be good going forward. And so you've sort of like gestured at this already, right? They're the best capitalists are the ones who rake in, even then, not that much, but a little bit of money. But I would love for you to talk a little bit more about who does do well and what campaigns do actually produce success on a platform like this, and who doesn't, who's sort of in that 50% of campaigns that don't get any donations at all.
Yeah, thank you. And let me actually preface this by thanking you for the earlier comment as well about sort of the means testing and the truly like very horrible, very long history we have in the US of excluding people from basic rights based on characteristics. And there's such a rich scholarship in terms of the idea that so much of this is rooted in racialized capitalism, right? The dual notions of both racism and capitalism as exclusionary. And that's one of the things that I'm really trying to kind of pull apart in the book. And it really relates to your next question, which is about sort of who does well here. And I always hate answering this question because all of us at some point in our lives may need to turn to crowdfunding, and certainly all of us will be asked to donate to crowdfunding campaigns. And I would never want someone to not use a tool that is available to them or that they need, either because they feel shame about it or because they're worried that they might not do well. But I think over the period of time that I've been researching GoFundMe, I have been consistently horrified by just how poorly this approach works for the people who need it the most. So what a lot of us don't see when we go to a site like GoFundMe is that there's maybe two baskets of reality on charitable crowdfunding sites. The first is campaigns that are doing very well, that are raising oftentimes tens of thousands, if not millions of dollars, that are traveling very far across social media and news networks. These are the campaigns that we all are most likely to see because that's how social media works and that's how these platforms work. That is a very, very small slice of the overall experience. The vast majority of campaigns typically circulate through a small network of often known friends and family and contacts, and raise a much more slim amount of money. So maybe in the realm of like $1,000, a couple $1,000. And then what a lot of this conceals is that there is a significant portion of campaigns, particularly when it comes to medical needs as well as basic needs. So people who are trying to crowdfund for rent, housing, food. Typically with those campaigns, we see about 30 to 40% of those get no donations whatsoever. It's really hard for us to think like, how could that get nothing? And I think there's a lot going on there. The first is exactly what you've pointed to, which is the shame, the difficulty of asking for help. A lot of people decide to not spread their campaigns very much because they don't feel as deserving as other people, or they feel a lot of shame about asking for help. But a lot of people are also crowdfunding within communities that are already very financially depleted. Most people's social network looks like them and has a similar income to them. And what we see is that crowdfunding tends to be more popular and less successful in communities that need it the most. And that includes whether you slice it by income level or education, but also if you look at communities that carry the largest medical debt, communities that are the most or the least insured, that kind of holds true. And then I think in particular communities, we also see the effects of things like discrimination and racism. So typically we see poor outcomes for campaigns for Black campaigners, in particular Black women campaigners, in the trans community, despite the popularity of crowdfunding in the trans community and the disability community. It just kind of plays out along the lines that you would expect. And yet at the same time, I think it's safe to say that social media has a really strong amplifying effect here, particularly like the more popular a campaign gets, the more we see those discriminatory effects.
Yeah, and I know Maddie is noting like the support that she's offered to friends who've had campaigns, and I feel like it's important context here that Maddie is like a social media genius and runs our TikTok, and so this is like, again, reinforcing what you're saying about having to have a very particular set of skills in order to sort of like, be able to, or just having to perform and like have the right coincidence of some particular set of eyes getting on the campaign at a particular moment, things that aren't universalizable in any way, in order for these campaigns to produce the type of thing that folks really need. And
I will also say, like, I've talked to a lot of organizers who are like real experts at crowdfunding. And one of the things I've been hearing more and more is that as these platforms just continue to grow in popularity, it gets harder and harder to break through, even with like all the right moves and a huge social media account and, knowing in a really expert way how to build a campaign. It's getting harder and harder to run a successful campaign. And I think that should scare all of us, right? Because we are rapidly reaching a point of sort of like saturation of this market that is making it even more unequal and unfair.
Yeah, and that sort of leads to, I think, maybe the question that undergirds a lot of our organizing work, which is like, you know, and I can frame it in relation to some of what you write about too, which is you make this clear distinction between downstream and upstream approaches to problems like the crisis of our healthcare system, and the crisis of you know, class inequality, you know, racism, the various types of inequalities and hierarchies that structure our lives so unequally. And so what I want to ask is like, what do you mean by these terms for those of us who might not have heard the sort of downstream versus upstream anecdote about the baby in the basket and stuff? What do you mean by these terms, and what makes a downstream solution insufficient for an upstream problem? And I think that then kind of brings us into the question. So like, how, without money or lobbying power, how can we address the structural problems, the upstream problems, rather than getting caught in this like downstream site that, as you say, has reached really a saturation point? And this can be, you know, I think these are questions that I'm raising this so that people in the room can think about these things too, because I think after this, we're going to open up the floor for some more input. But yeah, sorry, Nora, go ahead.
Yeah, I mean, I really wanted this book to not just like critique a thing, but to really point us towards better ways of organizing and better ways of working in community with one another. And so in public health, we have this really common sort of story that we tell about the sort of downstream, upstream metaphors. This is something I teach all my like public health 101 students, you know, and it's the idea that you imagine that you're on the banks of a river and suddenly someone floats by and they're drowning and they need help, and you rush into the river and you drag them out, and it's very labor intensive, and you get them to shore, and no sooner do you get them to shore, but you turn around and someone else is drowning in the river, right? And you do the same thing again, and you do it over and over again. And yet at a certain point, like all of us have to start thinking like, why are all these people falling into this river? Like, what is going on upstream? And so it's really a parable about how we can get really caught into a mindset of very resource intensive rescue because we have so many crises, and we're really in this like stage of sort of late capitalist polycrisis, right? And so we're just like inundated with crisis. It makes it very hard for us to think upstream or to look upstream and to think like, okay, there's actually way better ways that we could prevent this from happening in the first place. And oftentimes in public health, especially, those preventative actions are far cheaper and far less emergent and easy, quite honestly, easier to do than the sort of downstream sexy rescue operations. And that's not to say that we shouldn't also be rescuing people, right? So part of the ethic of mutual aid is like, we're going to meet your immediate needs, and we're also going to build the capacity to respond more upstream. But if you think about crowdfunding, it really is this like profoundly downstream thing. Like someone has already gotten very, very ill. Someone is already financially precarious. Someone is now reaching out to a crowd in oftentimes, you know, like the most common phrase I see in GoFundMe campaigns is, we have nowhere else to turn. You know, it's the end of the road. So I'm always trying to help people think like, where are the places that we could not just spend our money, but also our energy and our attention that would be better suited and in many ways a much more effective use of our resources. So I promised the organizers that I would not just like professor today, but I do have like one slide that I actually think is very helpful for people to see. And I think, Lindsay, if you could share that. So what I tried to do here is try and stack like the sort of scale of GoFundMe against other kinds of health financing strategies. So I'm sure all of you are aware the total US medical debt in the US is around $220 billion. And one of the strategies that folks have been using in this space, in addition to really advocating for debt jubilee and debt abolition, is also helping patients get the charity care that they're actually entitled to get if they meet certain criteria from public hospitals in the US. So about $28 billion annually of care is actually covered under charity care national rules by hospitals when patients seek it. Another $14 billion of charity care is actually owed to patients, but patients don't access it because either the hoops are too hard to jump through or they're not made aware of these charity care programs by hospitals. And so organizations like the Debt Collective and also $4 have really been trying to educate patients to make it easier for them to access these charity programs to which they are entitled, right? So that's another $14 billion annually. Now, it's really hard to get data from GoFundMe directly. They're a privately traded for-profit company. They do not have to share a lot publicly. But if we take them at their word, in about a 14-month period over the last year, GoFundMe says that people raised about $13 billion on their platform. That might seem like a lot to us, but we also have to remember that people are crowdfunding for all kinds of things on the platform. And so if we took a rough slice of probably the amount that's being raised for medical stuff on the platform in a year plus, it's around maybe $4 billion. Then we also have to remember that GoFundMe is an international platform, so only a portion of that $4 billion is actually being raised and funded in the US. So even given very generous estimates, GoFundMe is a very, very, very small proportion of other kinds of ways of getting patients access to care and addressing medical debts. So just as an example of a different kind of upstream action, and this is very mainstream, right? This is like a Biden policy. We're not talking about like, Bernie Sanders here. But Biden has proposed a standard across the board billionaire tax of 25%, which it should be noted is still less than what many middle income Americans pay as their tax rate. But he's proposed this 25% across the board billionaire tax. It would be applied to roughly 1,000 people across the United States. It would generate $50 billion a year. And so I think that to me points to the possibilities for other kinds of actions that can generate so much more revenue for our healthcare systems and so much more help to people who are facing the undue cost of care. And those are just the financial options, right? There's plenty of political options as well in terms of our organizing. I know you all have been working really hard on organizing for, not just debt relief, but also to get debt struck off of, folks' credit reports. There's also so many additional ways that we can pour resources into getting people on existing healthcare programs to which they are entitled, right? As well as, really fighting in states that have rejected the Medicaid expansion to expand Medicaid to their population, which their population is entitled to. So I think we can, we're at a kind of moment where we really gotta refocus the efforts. And I think we can say there are times in which crowdfunding is a really important community organizing strategy. It's a way of bringing people together. And also, it doesn't have to be the only thing that we're doing. It doesn't have to be the only thing that people have to turn to when they have nowhere else to turn.
Yeah, thanks so much, Nora. And the graph is definitely not too professorly. It's very, very helpful. And I think another thing that feels important to remember when we're looking at these types of numbers and these breakdowns too is the amount of money public money that goes into subsidizing our profit-driven healthcare system. That's like if we actually think about how much is put into making the same institutions that are really failing us very egregiously. Our health insurance companies, pharmaceuticals companies, hospitals, these nonprofit hospitals Nora was talking about get huge tax breaks and other subsidies. If we think about all the money that's on the table there, that's going to sustain this system that's trapping us in debt, there's like even more, there's so much more on the table that we can grab. And I want to use this like really beautiful and important point that you made as like a sort of transition into taking some questions from folks here, and also to name, in case these people don't have a chance to come off mute and weigh in, like some of the alternatives that aren't simply, I mean, we do a lot of policy stuff, but we have friends who I see in this like Zoom room who have talked about other structures where you can be in solidarity with one another without having a sort of like very finessed knowledge of our political system or a ton of money. I won't name her specifically in case she doesn't want to be named, but one of the leaders of our Debt and Disability Working Group who's here today has said at one point in the past that she's part of a network of disabled folks who, the way she put it was like, we end up passing around the same $40. Like that, this $40 is owned by us collectively to whoever needs it at the moment. And that to me is such a more like inspiring and moving and hopeful image than that of just sort of throwing money at people and hoping that you don't have to do too much work to support them, that's enough. And I know that we have another friend on the call who's part of Put People First, Pennsylvania, and they do call-in days to various dentist offices, hospitals, where their members are in debt, to demand that debt be canceled, and that insurance companies push claims through. So there are so many, I mean, just so many different creative, exciting ways to intervene here that don't require us to have endless resources. And I'm so glad, Nora, that you like really fold that into the fabric of this book. It's such a hopeful opportunity. And so I am going to pass it over to you, Margaret, to sort of guide us through a Q&A. I think we'll allot maybe 15 minutes for this, which will put us just past 8 o'clock, but I do want to be sure that people have a chance to ask questions. So go ahead, Margaret.
Yeah, thank you both so much for this like discussion, and I'm like, yeah, already getting all like lots of all caps in the chat from me. Samara, there is just looking at the chat right now. First, I'll say I want to solicit anyone to please like type stack in the chat or ask your questions like Kevin has. Yeah, I would love to reach out about the Chicago chapter. Because there are some people, we've got chapters in cities across the country organizing, and we can reach out with that. But then yeah, other people, please get on stack, and I guess we'll go to Kevin's question first. And again, these can be to Lindsay or Nora or both, or if you want to share an experience that you've had with this relevant to the discussion that we're having. But Kevin says, I'm very interested in working on medical debt in Cincinnati. Is there any action already going on around here? Yeah, we can also get in touch with you about that organizing. I think yeah.
Yeah, one question that was fielded in the chat earlier that we touched on a little bit, but didn't, I think, dive too deep into was Kevin earlier asked or said that he was curious about the demographics of people who have successful campaigns around race, class, gender, etc. I guess that would be directed at Nora.
Yeah, I think we see a lot of different disparities. So I'll give a couple examples, because as with any space, the disparities are complex and they're intersectional. For example, with some amazing colleagues, a student and a fellow faculty member, Erin Davis and Shauna Carlisle, we took a slice of the top performing medical campaigns from GoFundMe. So we basically said, okay, like, what are the top of the top? Like, what went most viral over this like 10-year period? We looked at all campaigns for medical reasons that it raised more than $100,000. And then we sort of said, like, who's here? So if this is what the crowd elevates, like, what does the crowd elevate? And it was more men than women. It was more young people. It was primarily people who are young or children with cancer. It was overwhelmingly white. And in particular, we saw evidence of that, like, intersectional disparity. So it was a group of almost 850 campaigns, and 5 were for Black women. And so at that scale, you really see the very, very profound impacts of those intersecting disparities. There were also 0 campaigns in that group that were for trans folks, very, very, very few that were for disabled people. And then there's weird things, like, so for example, in another study that we did, we figured out that like 80% of campaigns that are started for another person are started by women. So you have this like bizarre form of like online gendered care labor that's happening, that is being performed almost entirely by women or femme folks for other people. So there's a lot that we could unpack there. Study after study really just does document that like what you would expect to be happening here is happening here. Even when I think companies like GoFundMe are trying to really, really, really paint this like PR picture of like a very diverse, like very progressive sort of sphere of crowdfunding. Also, can I just say, like, yay for all the organizing comments? Like, this is exactly what we want to be doing. So, like, awesome. And I'm fine to like see the rest of the time so we can just like get folks organized as well.
Next, we have a question from Diane. Do images help a campaign like they do for social media in general?
Yep, images, videos do seem to help campaigns. However, I also think there's this weird phenomenon of how image heavy social media is. I do think that that tends to also work against certain marginalized populations, whether that's by race or by body shape and type, or, you know, there's like a lot of ways that that can also amplify discrimination.
I'm going to put myself on stack next because I actually was curious about this when you were originally talking about just like the definition of crowdfunding, and but are there like, have you gone it more into like research on like the old school version of crowdfunding and what those campaigns used to look like, and did it follow a lot of the same patterns, you know, that same, I'm just thinking of, yeah, the coin jar at the grocery store, for example.
You know, I haven't looked at a lot of that. I think other folks have. It was often though on a much smaller scale and a much more communal scale, right? And so I think part of what's happening with this largely being done through social media right now is that it is encumbered and also enabled by all of the dynamics of social media and this broader sort of internet crowd that gets involved in campaigns. And so that can be everything from like, oh, I didn't even expect this campaign to go viral and it did. And overnight, like I have all these weird people messaging on me online, or it could be like, you know, feeling like you're being targeted by a lot of internet hate, or it could be like all of the positive stuff that kind of goes along with going viral. So I think it's really important for us to recognize this as a tech phenomenon. The thing I will say is that there are other places. So I continue to do work in parts of sub-Saharan Africa, and they're very robust, like WhatsApp groups and sort of online money lending apps that are very much used, but they're also like very culturally embedded. So a lot of people have existing ways that they've always kind of been in community and saved money communally or raised money communally and kind of passed around the hat. And so I think in those places where you have those different kinds of cultural institutions and backgrounds, it does take a different shape. Or for example, there's a really interesting phenomenon of like Muslim crowdfunding that is very much rooted in like Muslim practices of Sadaqah, which is very, very different. And so, of course, like our social media takes on the flavor of our like social systems and cultural systems, and varies from place to place and also from community to community. Like I talked to plenty of people for the book who were like, I'm from an immigrant or like Latinx community that's like completely uncomfortable doing this stuff online. And we like throw fundraisers in person and like cook for each other. And that's what we do, you know? So there's all of that.
Thank you. Yeah, that's super interesting. And yeah, I can imagine the coin jar didn't ever go as far as worldwide. A question from Kevin, can you share more about the charity care, specifically care that people are eligible for and aren't receiving? And yeah, we're definitely interested in this too. This is something Debt Collective is, works on a lot too.
Yeah, Lindsay, do you actually want to take that one? You probably know more about it than I do.
Yeah, I was like, I'm not going to jump and offer, but I should message Nora to let her know that I'm happy to take it. Yeah, so Kevin, this has been a big focus of my work over the last like 4 or 5 years now, in part because as Nora's bar chart was sort of identifying, there's a lot of money that patients are entitled to that they are not being made aware they're entitled to, and in fact are being sent to collections, sometimes hit with lawsuits, sometimes hit with liens on their homes, sometimes hit with wage garnishments. And so the gist, without like boring everyone here too much, is that nonprofit hospitals in the US, which are the majority of hospitals in the US, about 2/3, they're private, to be clear, but they're nonprofit. They get these really massive tax exemptions as a condition of their nonprofit status. They're not required to pay a lot of property taxes, and there are some taxes that they have to pay. A huge number of them they're exempt from. And they also receive other forms of public subsidy as institutions operating outside the profit motive. The thing is that through the Affordable Care Act, there was a clause that was added to the IRS code around nonprofit hospitals that requires these hospitals, in exchange for their nonprofit status, to offer free and reduced cost care to low-income patients. And it's, the way that it's generally understood, although this isn't written into the law, which is a big part of the problem, is that the idea would be that because these hospitals are supposed to be operating as charities, supposed to be serving people, are not supposed to be massive revenue monsters or economic behemoths, that they would be more or less zeroing out the value of their tax exemption by using it to cover the cost of care for patients who are unable to pay. However, as we've talked about, we have a healthcare system that's driven by profit, by expansion, by growth, by revenue returns. And so what happens in many cases, not all, there are some exceptions to the rule that are really notable, but in a lot of cases, hospitals will, I think it's fair to say, like quite deliberately avoid making this information available to patients, organize pretty complicated qualification processes. We were talking about means testing earlier. There are lots of hoops to jump through to get this thing, often in cases where it's very clear that a patient should be eligible. So I'm gonna stop there so that I don't waste too much time, but it's a little complicated, but it is an area that I think, there's such a clear gap between the stated mission of nonprofit hospitals and the way that they actually operate in our society, which is increasingly as these like massively powerful economic forces. And so that's part of why we've been organizing there. They're also the main creditors in medical debt. So there's that. But yeah, thanks for the question.
And
And
Lindsay, if
then
I could just add to that, like, I think there's a way in which like all of these systems that surround those behemoth private institutions of our healthcare system further prop it up, right? They further legitimize it and make it seem okay, right? And you see that phenomenon very much with crowdfunding. So common to talk to people who are like in the hospital and the nurses are telling them, or the social workers are like, okay, well, it's time to set up a crowdfunding campaign. Like we got to get you out of here. And all of that just serves to kind of prop up this market-driven model and these incredibly profitable companies, including GoFundMe, that are profiting from the system.
Yeah, such a great point, Nora. And I wanted to say for people on this call that this is part of why sometimes it can be useful just to like remind people how absurd this situation is, like, and rather than being like, okay, let's get this GoFundMe set up, or even if you do it, as many of us have and will, to remind yourselves and the people around you as you're doing it, we shouldn't have to do this, because what you're saying, Nora, is so true, that we just sort of like, we just sort of absorb all of that resistance to like this really horrifying infrastructure when it becomes the norm.
And I'll just connect that to another question that I see in the chat, if that's okay. There's a question from Leona, and I think it relates to another question about sort of like, where is this whole crowdfunding economy going? And what's really interesting to me is you see people like the CEO of GoFundMe saying things publicly like, we really don't want the platform to be used for these like super depressing things like medical debt and like rent and how you can't feed your kids. Like it'd be so much better if you could do like something more heartwarming. And like we can't fix America's problems, right? But at the same time, they're very much profiting from that system. And I would say it's hard to imagine how they're not invested in that system to a certain degree. At the same time, the company will say things like, their grand ambition is to be the one place online where people go when they want to give anything charitably. So that's a very big, like Silicon Valley disruptor sort of vision, which means that like every time you go and give to a nonprofit or any sort of community organizing campaign that would go through that site. That to me is very scary, because in part because they are a for-profit company, and also because in the process of hosting these many campaigns, the company has accrued an inordinate amount of personal data. We have no idea what they do with it. They have the information about the giving preferences of hundreds of millions of people. And they want to kind of become this clearinghouse for how charity happens and how giving happens, not just in the US, but around the world.
Margaret, do you want to, I think there's like another comment in the chat or another couple that we can, I think if we can
I see you addressed
the ones there.
Ivan's and yeah, Leona and Diane's questions are sort of related to how you just answered that, but we have Benina or wait, I'm looking for another question in here, sorry.
I think I was looking at Diane's, who was just asking what happens when medical for-profit corporations start promoting this type of crowdfunding, which, as Nora was saying, like, and it can be a conscious move by corporations, and it can also be a sort of like well-meaning thing by healthcare workers who are just trying to kind of like help patients get through the next week, not have to panic quite as much about the debt that they're racking up by being in the hospital. I know Ivan said in the chat that I think that ship has sailed, and it's, it's true. And it's also, as we were saying, there are ways to together collectively to fight back against the fact that this has become a norm, the fact that we're now seeing medical credit cards with, high interest rates that will start accumulating after 6 months, and it's in the fine print. I think, they're the kind of theme that really is consistent throughout Nora's book is that, and as we said early in this call, is like, we don't think that crowdfunding for healthcare is bad, but we can't all, it would be irresponsible to ignore how it reinforces the infrastructure of our current healthcare system. And then Margaret, do you want to, I don't know if there are others in the chat that you've been.
Yeah, and then, yeah, we can get to Kevin's last question here. Are insurance companies changing their behavior in response to the proliferation of crowdfunding? And then, yeah, and then Diane's next, and we can close stack after that. So Kevin's first, and then any commentary about the idea that crowdfunding sites are skimming off the top of charitable giving, thus leading to the recipients receiving less.
Oh my gosh, such good questions. I feel like we could keep going for a long time. So I'll also say, like, you can find my website. You can welcome to email me other questions. I'd love to be in contact with folks. I have seen insurance companies, actually life insurance companies, being really critical of crowdfunding, because a lot of crowdfunding actually happens for like funeral related costs and expenses. And they're sort of like, look, you could crowdfund, or you could like pay for life insurance, and it would be more kind of like quote unquote responsible for you to like get life insurance. I think I haven't seen as much directly from insurance companies, but interestingly, I've seen some new crowdfunding platforms emerging that are sort of like positioning themselves as like crowd-funded payers to healthcare institutions. So basically what they're saying is like, the problem with crowdfunding is like, you can't verify that if you donate to a campaign, it's actually going to someone's medical costs. But what we're going to do is set ourselves up as the hospital payer, but we're going to like crowdfund for the person or help them crowdfund. And then we'll like pay their bills directly based on how much they earn. So I do see that as a sort of like twisted sort of new kind of version of this phenomenon. And then like, yes, it is charitable crowdfunding sites, like quote unquote charitable crowdfunding sites, are very much for profit, and they pull a percentage off of all donations. And then they ask also donors to give a fairly substantial tip on top of their donation. So one thing that I hear, especially from crowdfunders who are less successful or who are more low income, and therefore like really paying attention to like the dollars and cents of every single thing that's going into their campaign, of course they are, is that those things that are skimmed off the top, they really hurt, and it feels really substantial. And it does very much lead to them earning less. I will end all of this by saying I really think there are a lot of good alternatives out there, not just the like radical political organizing work, but like also just like a lot of alternative ways that we can help people afford their healthcare. And so I hope that we'll kind of help each other to sort of think through those options, while also not making folks feel shame for having to turn to this, because it is very much a product of a very broken and messed up system.
Thanks so much, Nora. Sam, do you want to just close us out with some of the ways that folks can plug in to those the projects of building those alternatives?
Yeah. Yeah, I mean, first and foremost, I want to thank Nora for being here and say, like, everyone should go buy her book. I think Marge just sent the link to that in the chat. So yeah, everyone go check that out, get your copy of the book. But yeah, in terms of ways to plug into this, I mean, I think this talk has really, again, just like reinvigorated me around the fight for equitable healthcare system. And if it has for you too, you can get involved by filling out our interest form to make sure you're in the loop about all the future events we have and all the organizing work we have going on, which I believe Lindsay is going to send that interest form in the chat. And then also we have an upcoming event next month on July 9th, Tuesday, July 9th, where we're going to be talking about the Consumer Financial Protection Bureau's basically move to ban the reporting of medical debt on credit reports. And we'd really love to see some of you guys there, or all of you guys there. And we will be sending an email with registration links for all of that and the interest form link. as a follow-up to this call tomorrow. So yeah, thanks everybody for being here. Nora, if you have any like final thoughts or anything, feel free to come off and share. But I know you kind of just.
I just want to thank you all for your time and your support and your interest. This was a great conversation.
Yeah, thank you. And thank you everyone who came out and yeah, listened through the call and shared their thoughts. But yeah, I think that's everything. We'll send the email tomorrow, and it was really nice to have everybody here.
All right. Thanks, everyone. Thank you, Nora, so much.
Thank you. I really appreciate it.
We
Bye-bye.
do too. Bye.
Thank you all. I got to sign off and get home, actually, but thank you so much. This was awesome.
Thank you, Nora.
Thank you, Nora.
Yeah,
Thanks.
And
learned a
happy to be
lot.
in touch about other follow-up steps. And I'm going to try and join that next call as well. So thanks.
Yes, that would be amazing. Yeah, and I'll follow up with some information about the folks who registered and attended and stuff, so that you have a
Okay,
sense too.
yeah.
All right.
Bye.
All right. Thank you,
Thank you.
everyone.
Great.
Bye.
Thank you.
Bye, y'all.
Bye.